Okay, I'm speaking with Clay Van Houten, and Mr. Van Houten, you are to give me your title again, it was kind of a mouthful.
It is a mouthful. So I'm the Infectious Disease Epidemiology Unit Manager at the Wyoming Department of Health.
And needless to say, we're talking about the COVID-19 pandemic in Wyoming. First of all, I did want to ask about cash because our city of Cheyenne is not accepting cash at some city functions starting tomorrow. How much do we need to be concerned about handling cash in this outbreak? Is it a big problem?
Well, I think any measure that we can take to, potentially limit the spread. I mean, there is some evidence that the virus can stay on surfaces for an amount of time. There's various studies out there showing different amounts of times. But I think really anything anybody can do to limit contact with others, I think is a smart move at this point.
So individually, should we be trying to use debit cards and credit cards as opposed to cash?
Yeah, I think really those small interactions that happen with payments aren't necessarily the biggest risk. Honestly, it's people that are sick, and if you're sick, just staying home is really the biggest thing. We've found through the outbreak, the CDC, others have studied this a lot as this has unfolded, just trying to learn about the disease. And it really does look like that people are really the most contagious to others the more sick that they are. So when you're really showing those signs of runny nose and coughing and sneezing and a fever, just stay home. That's the big key message. The little things of using debit cards and those things aren't going to play a huge role. I think really the big thing you're looking for is just people staying home when they're sick. They're the ones that are most contagious, and if we can keep them home, that's going to make a big impact.
Now, the governor this week also asked people to just stay home in general if you possibly can. Is that something that people need to really get serious about, or is that kind of a marginal thing?
No, I think the governor obviously is taking this very seriously. We see other states that are implementing very similar control measures to really limit interactions with others. And we know that this social distancing piece that we keep talking about, really limiting interactions with others, is such a key part of trying to just keep this as under control as we possibly can for as long as we can. And that is exactly right. Governor Gordon, really told people just stay home, whether you're sick or not, and really limit those interactions with others. Those social distancing pieces of the control is such a big piece of this.
Now, as far as our day-to-day lives, going to the grocery store, for example, if we do that multiple times a week, are we putting ourselves at risk?
No, I think, again, if we think about this with some common sense and really try to limit those interactions as much as we can, that's great. There's obviously things that still need to happen. Going to the grocery store obviously is one of those key pieces. We just have to do that. People need their food, they need their medications, those types of things. So really just being smart about that when people are out doing that. If you're sick, have somebody else who's well, go do that. If you need help from somebody, a neighbor or someone else, have them go to do those things for you if you're sick. That'll be a big help. For the well people that need to go do those things and be out and about for essentials, just be kind of smart about it. Kind of try to the 6 feet rule is a pretty good one to follow when they're out. Just try to limit really close contact for a prolonged amount of time with other people. And certainly when you arrive back home, make sure you're washing your hands, those types of things. Those really basic things that really actually do make a pretty big impact.
Now, there are still restaurants doing takeout service here in Cheyenne. Is that safe to eat?
Yeah, yep. We feel like that's still a safe measure. If further measures need to be taken, it'll be weighed very carefully. If there's more control measures we need to take as a state and locally as well, those will be taken. But yeah, those things like takeout, those types of things, it's again just those are still following the really good recommendation of just limiting these large gatherings, limiting close interactions for long periods of time. that's still it's still fine, and it's still acceptable, and it's still contributing to help try to slow the spread of the disease, but also get people food that they need.
If we know, and we may not, because I realize this is still a fairly new phenomenon, can you get the virus by eating food that has the virus on it?
Well, it's really a respiratory disease. I don't think we know that for certain yet, but I think what we can tell from the dynamics of the outbreak right now, this really is a respiratory disease. So someone being in pretty close contact for a prolonged amount of time, and we generally say 10 minutes or more. If someone's around somebody who's sick, actively coughing, sneezing, has a fever, you're around that person for a prolonged amount of time in really close contact, that's really how you're going to get the disease. Certainly, we see other respiratory diseases, and this may be similar, where the virus can live on surfaces for some amount of time. There can be, you can touch your face, get the virus in the respiratory system that way. But really, the main driver of this whole thing, obviously, is very actively sick people that are contaminating things and spreading it via close contact.
So we're more concerned about breathing it in as opposed to accidentally eating something.
Yeah, correct. Exactly. I think we'll learn more about that, but it's pretty obvious that that's really the big concern, is really a close contact with somebody within 6 feet who's actively sick, and then breathing the virus into the respiratory system.
Okay, in case you're just joining us, I'm speaking with Clay Van Houten from the Wyoming Department of Health. We're talking about the COVID-19 pandemic in Wyoming. And Clay, I know we don't know a lot of this yet because we don't have much information to work with, but I'll just toss some questions out there.
Sure.
When do we think this might peak? I mean, are we near the peak yet? Is this going to go on for a long time, or do we know?
Boy, I don't think we know. We've seen some other data from other countries that are showing various time periods, and I think a lot of it we just really don't know, and it's really hard. And I know that the Surgeon General just the other day really warned against looking at what's going on in other countries. It's hard to predict, what's going to happen in our country based off of other countries. The societies are just so much different. The population demographics are different, and it's really hard to predict. I don't know that really anybody can say for sure when this is going to peak, when we're going to kind of see the end of this. I think we're all hopeful, obviously, that these social distancing and other measures we're taking now are at least going to take the stress off the healthcare system and protect as many people as we can for as long as we can. But yeah, that's really the big unknown, is trying to predict what's going to happen. It's kind of a moving target.
It's probably safe to say, though, that we haven't seen the peak yet. Would that be accurate?
I think that's probably accurate. I mean, obviously our case counts are increasing in Wyoming. We've seen cases reported nearly every day now for a couple of weeks. We're getting more, it seems, each day, and of course, part of that is availability of testing, which is becoming more readily available, and the turnaround times from some of the private reference labs they're getting shorter. So I think that's part of it, is just identifying people. That's going to happen, and our numbers will go up. We're just hoping to keep them low enough for now, and just keep people that really don't need to seek health care at home, and those that really do need to seek emergency care, there will be room for them in the emergency rooms and hospitals.
Speaking of which, how do we know that we maybe need to contact medical professionals? What are some signs?
Well, obviously the signs and symptoms are pretty widely out there. Fever, cough, runny nose, sneezing, shortness of breath is a big one. So, it's really people with underlying health conditions, diabetes, maybe chronic asthma, chronic smoking, those types of things. Those people, certainly older people, are more at risk for severe outcomes. So I think it's just one of those things. You kind of know your own health, and where you're really getting sick, seek health care. Call your physician, call a provider, certainly before you just show up at their office and discuss the issue, and they can then really determine clinically what needs to be done from there. Certainly if it's a medical emergency, people can dial 911 and get taken care of. But I think for most people that are going to get this virus, I think some of them are getting pretty sick, but I think really just knowing how sick you are and seeking guidance from a healthcare provider is the best advice we can give.
Is there any hope that we'll have enough testing kits in this state anytime soon so that everybody who needs to get tested can get tested? Because I know right now that's not the case.
Yeah, testing has been it's been a tough issue. I mean, really since the beginning. I mean, in many ways, it's pretty amazing that a newly discovered virus that we just essentially found out about it in December, that there's even testing capabilities within a couple months in the U.S. And that piece is pretty amazing. The testing right now. It's not an easy test. It's a PCR test. It's not a quick rapid test like a lot of people are familiar with when they maybe go to their doctor and they get a rapid strep test or a rapid flu test that they literally can do in their office. It's not that type of test. I know that there are a lot of companies working very hard on developing those types of tests, but as of now, it's a pretty complicated series of lab tests that the labs have to do. So it takes some time. There's obviously now issues nationally with supply issues with the transport media needed to put the swabs into, and even now some of the just swabs that they stick in your nose to take the sample. There's supply issues with that too. So it's kind of this ever evolving supply issue that I'm really hopeful that here quickly we'll have some other capabilities testing wise to more rapidly identify cases and get people those results quickly.
How concerned are you that our medical infrastructure in this state and medical personnel is going to be so overwhelmed by this that we run into a situation like, say, they have in Italy, where they just can't treat everybody? Is that a realistic worry here in Wyoming?
Well, I mean, I think that's something that we've been planning for years. We've done the influenza pandemic planning for quite a number of years. The hospitals in the state have all just done an incredible job just trying to prepare for these types of things for a long time now. We had Ebola scare a few years ago. There was a lot of preparedness done at the hospital level for preparing for these types of things. I think always especially in Wyoming, where we just have some limitations with the number of healthcare providers we have in the state. The hospitals are, for the most part, pretty small. So it's something that's always a concern when we have a pandemic, that's going to be the big issue, that our healthcare system is going to be overwhelmed. The hospitals really have good plans in place to help, mitigate some of those factors. And really that's, again, not harping on it, but it really is why a lot of these unprecedented measures of social distancing and business and school closures that's really why they are in place, is to try to just keep as much stress off of that healthcare system as we can for as long as we can.
So how are we doing? Is that working? Is it not working? Do we not know, or what would you say about that?
Yeah, I think right now it's working. The hospitals so far, from what we've heard, are not completely overwhelmed. They're doing a great job of preparing for additional patients and being able to, treat them in the facilities and see them. But we haven't really seen a giant surge. So I think, it's awfully early to say, but I think a lot of these measures so far are helping.
Now, there's been news from around the world with people, medical people specifically, experimenting with some different treatments. I know in India they've used a couple medications I won't even try to pronounce, apparently. They've gotten some results, I guess. How hopeful are we that we can learn to treat this so that it's treatable?
Yeah, viral diseases just in general are very, very difficult to treat. Bacterial infections, we've got antibiotics, and those are very effective and a lot easier to treat. Viral infections are just so much more difficult, and it really is interesting to see some of the studies coming out of other countries that maybe show some promise with some different types of treatments. We'll just have to kind of keep an eye on that and see how those unfold, whether they're real or not. But I know there's a lot of work being done in that area, and I know there's a lot of researchers working really hard on more specific treatments for this virus specifically. But we'll see. I'm hopeful that eventually they'll have something. But in general, viral diseases are just very hard to treat. You're basically just trying to support people and keep the symptoms under control as much as you can, and really letting people fight it off themselves. It's just kind of the nature of viral diseases.
Now, from what I've read, and I'm certainly no medical professional, but just as a layman, it sounds too like this could be a moving target because the virus may mutate. Is that accurate?
Well, yeah, it's certainly something where we've heard about coronaviruses. Obviously, this is a newly identified virus. It was probably mutated from one of the other coronaviruses. The coronaviruses are a pretty darn big family of viruses. Certainly, there's always, thought and concern of a virus mutating. I haven't seen really any good data that would suggest that that's going to happen very soon, or would likely lead to something that's more serious, or more of a concern. But it is something that we're definitely keeping an eye on, and I know researchers are. It's pretty amazing. They can sequence these entire genomes of these viruses and look for these little changes. So we'll just keep an eye on it.
What are the prospects for a vaccine being on the market anytime soon?
Well, the last I had heard from the federal government, HHS, was they were probably, I think, at best, maybe a year to a year and a half out before that would be widely available. There's just a lot of research that's going into it. It takes some time to develop a vaccine that's specific for a virus, and then, of course, it has to be tested for safety and make sure it's not going to cause more harm than good. So that does take some time. So the last I had heard was a year to a year and a half. I'm hopeful it'll be quicker, but that's kind of the federal government's best case time frame right now.
Now, from some reading I did on the Spanish flu pandemic a little over 100 years ago, that came in 2 or 3 waves. Are we concerned about that with the coronavirus?
That's a really good question. I don't know that we have that answer. Looking at other countries and the way the peak has come and sort of declined, it doesn't look like that is the case, but it's so early that it's just hard to tell. I think I'm very hopeful that these measures are in place, and we'll keep everything at a manageable rate, and hopefully not see these waves. But it's certainly possible. It's just kind of hard to predict.
Now, we've all read about washing your hands, using hand sanitizer, disinfecting surfaces. Are there other things people should be doing to protect themselves? Staying home. How about building up your immune system? Well, eating a lot of vitamin C, for example, is that helpful, or is that an old wives' tale?
Oh, I think a lot of those healthful things people do. Trying to eat very well, exercise as much as you can. Of course, we're having to do it all at home now, but yeah, eating well is always good for your immune system. Just trying to take care of yourself, get enough rest. That's always helpful as well. So, any of those things that people can do to just stay as healthy as they can while they're staying home is definitely going to help.
How worried should we be about this? Should we be terrified? Should we be concerned? What would you say?
Well, I'm concerned. I think the health department's concerned. Our governor certainly is concerned, and that's really why we're taking these. I mean, they really are unprecedented measures. I think we're concerned. I don't think we're certainly not panicked, and I hope certainly people do not panic themselves. But it is concerning. I feel like there's enough evidence out there that this disease can be very severe in older people and people with underlying health conditions that really could make an impact on our healthcare system and just people's health in general. That I'm concerned about it. So I think the measures that are in place now will really, I'm hopeful they'll really help, and we can kind of limit this as much as we possibly can. But certainly not panic time.
How soon do you think and this is another one of those, I get it, we don't know questions, but I'm going to ask anyway. How soon do you think we might be able to look at maybe resuming our regular work schedules and getting back to regular life?
Yeah, that's a really good question, and of course one I have myself as a father and friends with businesses, and that's certainly the big question. I think we're hopeful that at some point here quickly we'll see some sort of evidence, either whether it's national evidence or even statewide data and evidence that show, hey, we're really making an impact, and maybe some of these restrictions can be limited without overwhelming our healthcare system. I'm hopeful that will be soon. I really can't predict when because it's just impossible. But I know this is incredibly difficult for everyone, for parents and for business owners and everyone. So I'm hopeful that it'll be sooner than later, obviously.
Okay, my final question that I had prepared today, and this is another one that I realize we probably don't know, but it's something to hear a conversation about. Is there any hope that the warmer weather will dampen this pandemic? I know with the flu it tends to decline as warmer summer weather gets here. Do we know the answer to that?
I don't know that we do know the answer. We've been kind of looking at, again, other countries where, this was spreading, where it's, I guess fall now, but summer earlier, and there's maybe some evidence that suggests that might be possible. There are multiple coronaviruses that cause more common cold symptoms that circulate in the U.S. every year, and those do tend to kind of disappear in a way over the summer. We certainly see a lot. Obviously, flu is one. It sort of goes away in the summer. There's some very low baseline numbers each summer, but that definitely does decrease, and so does the common cold. That tends to decrease a lot in the summer. So I think we're very hopeful that the measures that are in place, and then maybe some warmer weather coming hopefully sometime soon in Wyoming will help, but I think it's just sort of unknown as to whether that's really going to be the case with this specific virus or not.
Clay, is there anything I haven't asked about that you'd like our listeners to know about in regard to COVID-19?
I think you've really covered everything very well. I know these are unprecedented times, and just be gracious and patient with everyone and help out, and just follow the direction from the governor's office. They really do care about everyone, and we are trying to protect everybody's health the best we can. So we'll just get through all of this as a state, as we do a lot of things. I love Wyoming, and everybody's a neighbor, so we'll get through it. And I think just follow those directions, and we'll get through it.
Okay, I've been speaking with Clay Van Houten from the Wyoming Department of Health. Of course, you folks do have a website up where people can check out the latest information. What's that web address again?
So it's just health@wy.us, I think. Actually, I'm probably going to tell you that wrong, but yeah, good grief. Is it terrible? I don't know our own.
Sorry to put you on the spot. But I do appreciate your time this morning. Thank you very much.
Yep, you're very welcome. Thank you.